Hey guys, Peter here from Team Sapiens PT. Today I wanted to talk about back pain. The reason is it's one of the most common diagnoses from a rehab perspective that we see, and in general in the world, most people, you're going to be probably an outlier if you don't have an episode of back pain. The numbers range anywhere from like 60 to 90% of people will have back pain at some point in their life. So I think part of the ongoing problem for people with back pain is something that they might have heard in their advice that they've been given by a healthcare practitioner. So I wanted to talk about probably some myths that you might have heard. Although a lot of back injuries happen bending forward, that doesn't necessarily make that movement inherently dangerous. Same thing with twisting. Think about a knee injury like an ACL tear. Once that happens, there's almost always a plan to get that person back to whatever it was that they were doing when they suffered the injury. So whether it was playing basketball, soccer, skiing, there's always a plan. You know, you're going to go through these steps, you're going to do this, this, and this, and then however far down the road, you're going to be back to whatever it was that you were doing. So I think a lot of the time the advice for someone that has hurt their back while bending forward or twisting is to stop doing that motion or avoid it, and that doesn't really make sense to me. So at Team Sapiens, we take a different perspective, kind of more along the lines of the knee injury that I just described. All right, you hurt your back moving or bending forward or twisting. Let's take some steps to get you back to doing that, and then maybe even develop a bit of a buffer. Let's make you even better than you were before, so that hopefully the likelihood of this happening again is less. So I wanted to show you guys some later stage strategies that we use for someone that might be a little bit fearful of bending or twisting. So I've got some yoga blocks here. Another example of some target practice that I like to use with people because I think it eases some anxiety when they have a very concrete destination to get to in terms of their movement. They can see their progress easily. So you might start with something like trying to get your fingertips to a block. And again, if they're not even comfortable going that far, then you start higher. Let's say this is a challenge for them. So we're going to practice some stuff here. Eventually, over time, we can take a block away, work lower, eventually trying to get to the ground. We can combine motions here. Maybe you have them stand a little off center, add a little bit of a rotation or a twist to it. And then you can also progress the forces. So I've got a kettlebell here. Same idea. Again, having that target there, let's say they're nervous, they can always, getting there can, maybe let things go. There's a lot of different things that you can do with this. But I find that using those targets kind of eases some of that anxiety. Takes the focus away from their back, away from their form, which usually perpetuates those feelings of, oh, I need to be careful of my back. Spines are resilient. That's one of the big takeaway messages that I want you guys to get from this video, is that you don't necessarily have to guard your spine. Maybe in an acute injury case, you might have to be mindful or modify some things because there was an injury. That just like anything else, if you sprain an ankle, maybe you put it in a brace for a week or two, but then there's a progression to get out of that. So same thing with the back. If you pull a muscle, if you sprain something, maybe you have some strategies to be careful for a few weeks, but then you got to have a plan to get beyond that and back to how life was before the injury happened. So an important point that I think gets missed a lot, hopefully you guys learned something and it's maybe a little bit different than what you've heard in the past from a healthcare provider or physical therapist. Like I said, a lot of people are told don't bend, don't twist. We kind of take a different approach to that for the reasons that I just discussed, because you're bending and twisting are important things. Like even if I just want to get my shoes on, I'm going to have to bend, I'm going to have to rotate. Very simple things in life involve those motions. So again, we take that approach of get you ready for them, develop a plan so that it's not an issue down the road. Subscribe if you guys like the video, then you'll get notifications on anything new that we post. Till next time, take care.